Thomas, you just wrote a book called The Decision Tree. In fact, I think we have a slide that shows what it looked like. What inspired you to write that?
So I've been a journalist for a long time, about 15, almost 20 years. And I come from a family, though, of healthcare providers. So I have the proverbial dad who's a doctor, mom who's a nurse, et cetera. So it was always interesting to me, the idea of healthcare and kind of how do we find our way and make our decisions and make kind of good health for ourselves. What I found in writing the book, though, was that there was an opportunity to engage some of the tools of technology that we write about at Wired Magazine, along with some of the principles of good public health that I had exposed myself to at Berkeley, getting a master's of public health. So the opportunity was to bring these two worlds together, to bring the ideas from the world of public health together with the tools that Jen is talking about in the internet and information technology, bring them together and really create what hopefully is exponential change.
Now we have a video which I think was produced by you, which illustrates some of the ideas in the book. So we're going to show that video, then come back and discuss the book further. So let's go ahead and roll that tape. Brief video displayed some of the issues raised in your book, The Decision Tree. Now, what does the book actually tell people? Does it give you a step-by-step procedure about what to do if you have a particular health problem?
No, it's not diagnostic or therapeutic at all. What it tries to do is present this new mode of engagement. You know, a lot of us, when we think about our health, it's a source of anxiety, it's a source of worry, it's a source of fear, and we tend to try to kind of push it aside and not worry about it, not think about it, until something goes wrong. And then that's when we kind of have an interchange with our doctor or the healthcare system. And oftentimes that's reactive, right? That's a reactive system. And it really doesn't create optimal health. And I think what Jen's working on at Contagion and what I'm trying to get across is this idea that when people actually take some control and have an opportunity to engage, their health becomes a positive thing. And that's what the video was talking about as a feedback loop. When you're starting to work positive inputs into the system, into the way we think about our health and the choices we make, you can actually come away feeling pretty good about your health.
Now, when we talk about a decision tree, is that something that the individual does by himself or herself? Does it involve a doctor? Is it like a flow chart?
Well, so yeah, I mean, a decision tree is another word for it is a flow chart. And what I mean by that is it's the decision tree is a structure or a trope, if you will, of basically active conscious decision making. So a lot of us make decisions constantly all day about our health, but we don't really think of them. They're kind of the things that we think about in the back of our minds. And as Jen makes the good point about these are micro choices. These are often little tiny choices, little decisions that we make that add up kind of in aggregate, in sequence, to become our health. And the more we are conscious of those decisions, the more we're aware of those opportunities to make better choices, the better our health will be.
Well, one of the typical choices might be, well, let's say I have a pain somewhere. Should I go see a doctor or should I ignore it? Would your decision tree help you make that decision?
Well, I think that one's pretty easy. That one, I'd go to the doctor with that one.
Well, it depends how bad the pain is, I suppose.
Yeah.
And then if the doctor tells me to take certain medication, should I take it or not? Maybe he's not really sure.
Well, right, and so one of the opportunities that all this information that's becoming available online and that we can actually personalize is to augment the conversations that we're having with our doctors or our care providers, so that they're not our sole source of information. You know, I think there's a lot of enthusiasm for the health information that's online, but we need to make sure that that's good information, that's relevant information first and foremost to our own circumstances. And to me, that's really what personalized medicine is. It's matching up the known research with our specific circumstances.
Now, in your job at Wired magazine, you're considered a trend spotter. Your job is to look for trends. Mm-hmm. Would you say that this type of personalized medicine is an important trend that's going to grow in strength?
I think it's a huge trend. It's if you ask me, it's a tidal wave. It's a new shift in the way we deliver healthcare and what we expect of our society and the members of our society. I think a lot of the conversation that's going on around healthcare right now is very much a top-down one, trying to have the government create coverage for everybody and whether or not that's the role of the government. That's a good and necessary debate, but there's another side to that. Individuals need to get engaged and need to take responsibility and start taking some action, and that's a very real thing that we need to do to improve the way we deliver health and to improve our nation's health.
Do most people want to learn more about medicine? You know, some people have the attitude that I want the doctor to make all the decisions. That's what I'm paying him for. He's the one who went to medical school. And medicine is the sort of thing where, a little bit of knowledge can be dangerous.
Yeah, well, certainly that is anybody's right? If you want to put your head in the sand, that's fine. The easiest way, the most simple way to engage in your health is not to think about it at all. So this, what we're suggesting in the whole idea of Health 2.0, it's more complicated. It's going to be a little more tricky. But the opportunity, the upside here is huge, right? The upside is better health, better life.
Can you give a specific example of how somebody might use your book in order to deal with an issue that they have health-wise?
Well, again, I'm not providing specific remedies, but what I'm hoping that the book does is it helps people understand that they have options and that there are ways that they can insert themselves into their own health care and their own health choices. Now, it's not all cut and dried. It's not going to be easy, as I say. But I think there are ways of engagement that really are quite powerful and quite positive.